My name is Jason Kempenich, and I am a general and bariatric surgeon here at UT Health San Antonio. My clinical interests include bariatric surgery, other disorders of the stomach like gastroesophageal reflux, and ventral incisional hernia. A laparoscopic sleeve gastrectomy is a procedure that we haven't been doing quite as long as other procedures like the Roux-en-Y gastric bypass, but now is one of the more common procedures done in this country. It's basically you want to remove 80% of the stomach, creating a pouch of the stomach that's about 80 to 120 milliliters. And you create, it's called a sleeve gastrectomy because you just have a sleeve of stomach, so a very narrow stomach pouch that helps restrict the amount of food that you can eat. So a sleeve gastrectomy most commonly is performed laparoscopically. It can be performed with a robot as well. A robot is really just a tool to help the surgeon operate, but most are done that way. Very, very rarely would a procedure like a sleeve gastrectomy be performed open. They're almost exclusively done laparoscopically, and that means with small little incisions and a camera and long instruments. Risks of sleeve gastrectomy, with any surgery, there's always a risk of bleeding, small risk, bleeding of infection, small risk. But with sleeve gastrectomy, the big thing we worry about is the potential for possible leak. We are going to staple and divide the stomach to remove 80% of it, and we don't want any of those staples to fall apart. The risk of that happening, fortunately, is less than 1%. The long-term issues with sleeve gastrectomy really are common to other procedures, any other procedure that you would do surgically in the abdomen. They are issues of having adhesions that could cause bowel obstruction potentially. There is a potential for risk for stenosis, but that's very, very rare, less than 1%. And then certainly the biggest thing we worry about with any patient who has bariatric surgery is weight regain. And that's why it's very important that patients continue to follow up with their surgeon and their bariatric team to make sure they're maintaining their weight loss off into the future after they've had their surgery. So after sleeve gastrectomy, your diet will consist of 5 to 6 times a day, a very small portion, high protein, low carbohydrate foods. That's the long-term diet. Immediately after surgery, the diet is a liquid diet of protein shakes for 2 weeks while everything starts to heal up. Then we advance for 2 weeks to a high protein, low carbohydrate, ground up food, kind of a ground up consistency. And then after that, you go to regular food that you chew, high protein again, ongoing after that. With the sleeve gastrectomy, we expect patients to lose 60 to 70% of their excess body weight after the surgery. Most of that weight loss occurs between the 6 to 9 month mark, but we really see weight loss all the way out to 18 months before patients typically stabilize.